As a physician within the Cancer Center, I take care of children who've been diagnosed with cancer. And one of the most important things that I can do is to reassure families that although things are scary right now, oftentimes there is hope, and we often have an effective treatment to cure their child of cancer. So oftentimes when people think about a cancer center, they think of only the doctors and nurses. But in fact, our team consists of many, many more individuals. We have child life specialists, we have psychologists, we have pet therapy, we have chaplains, all who are part of our Cancer Center team, and all who are knowledgeable about families going through their child's cancer treatment.
We really work together to hopefully meet the needs and the challenges that these families are facing. Sometimes it might be helping make sure that we connect to school services so that their homebound is set up. A lot of the patients that we work with that are on cancer treatments don't have the opportunity to return to school for quite a period of time. And so we all work together to figure out what that looks like and how to support that patient. So our role varies depending on what is best for the child. If they build a connection with a social worker, then we might spend more time with them, helping them process things. I also have the opportunity of working with our young adult population, specifically here in our oncology unit. And so a lot of those patients I build rapport with, I've had the opportunity to have some amazing experiences and connections with those patients. One of my patients was a wonderful singer, and we got connected to the studio downstairs, and he performed for tons of people across the hospital, bringing him joy in his journey, but also sharing joy with others.
It really is just the biggest blessing to me to fill that role. I think that, like we talked about, it's a really tough thing when you first get that diagnosis, and it is just such an honor to be able to meet these families in that space and provide some sort of comfort and understanding for them. I've met over 13 years just some of the most incredibly resilient and inspiring people that I wouldn't have otherwise met. And truly, truly, they give so much more to me in this job than I'm able to give to them. A really special thing that we have here are therapy dogs like Cantor. Kids love them. It brings so much joy for them to see dogs, particularly kids that if they have to be admitted for a while and if they have a dog at home that they're really missing. I mean, every day that I'm in clinic, I have multiple requests of kids like, can I see the dog? Can the dog come play? So it's just a really creative, out of the box way to bring some normalcy and happiness for kids here in the hospital, I think.
So I am passionate about my job because we cure children of cancer. And not only that, the survival rates for children with cancer are improving every year. When I started, perhaps 75 to 80% of children with cancer were cured. Now, in 2022, over 85% of children diagnosed with cancer will be cured of their cancer. And I find that to be incredibly exciting and very gratifying and encouraging